Okay, Amore, you have several different questions that you've posed on here, and I'm going to take them all individually and try to provide super short answers. A lot of this content is covered in my online program, so I don't want to spend a lot of time talking about it here because these are full lessons. All three of these questions encompass full lessons. So I'm going to give you the real short version here. Understand there's a whole lot more to this. So, one of the questions is when should you raise the bed? So if you're going to raise the bed up to a comfortable working height, when should that be done, before or after you wash your hands? And the short answer is raising the bed should be done before you wash your hands, because remember, once you've washed your hands, you're getting ready to touch the patient. You don't want to touch the patient with contaminated hands, especially if you're going to be in any part like their mouth or cleaning their eyes or their peri area. You don't want to be introducing bacteria. You want your hands to be nice and clean. So you do all of your prep work in the patient environment, closing the curtain, putting the head of the bed up, all of those things before you wash your hands. Second question is about dirty linen in the hamper. For the test, there will be a dirty linen hamper or basket at the end of the bed. You just put your linens in there. You're not going to have to transfer them anywhere. In a clinical setting, you're going to do what your policy and procedure tells you to do for that facility. Most facilities are using bags. They're soiled linen bags. The dirty linens go in there, get tied off, and then put in soiled utility room. So, but you'll go by your facility policy. For the test, you simply put them in the hamper and that's it. And the third question is the during peri care, when the after the peri care is done, do you recover them? And the answer is yes, you would. You want to minimize the patient for the smallest amount of time possible. So you're just going to roll that blanket and gown up, do the cleaning, do the rinsing, do the drying, and then roll that back down when you turn them over to clean their backside. Remember, this is somebody's mom or somebody's dad, and we don't want to expose them unnecessarily. And that's kind of the danger in healthcare. Sometimes we get so focused on our task and our role and all the things we have to do. And sure, we see a lot of private parts as part of our daily routine. But remember that we have to protect the patient's dignity. Don't let it get so commonplace in your life that you forget that there's a human attached to that patient. Don't forget humanity. And that's a real big danger in healthcare. And we've got to really make sure that we're taking that step back and remembering that this is somebody's mom or dad. And just treat them with dignity and respect, the same way you would want your family treated if they were the ones laying in the bed. I hope this helped, and best of luck to you. Bye.